My experience was very good. I didn't know what to expect. I was followed very closely. The staff was very friendly. Everyone is very nice, and they put you at ease.
Before I ask you what made you call, I mean, obviously there was some thing in the back of your head that said, you know what, maybe I... Did you have any treatment prior to going through one of these studies?
I had had treatment years ago for depression and anxiety that didn't totally take away all the symptoms.
Okay, and so you felt something, you said, you know what, Doc is on TV, I think that it might be a good idea to do that. Now, you went through how many studies? One or two, or which one are you in now?
I am in the same study in the second part.
Doc, how does that work?
So in the first study, in a lot of these studies, they're adjunctive, they're additional studies. So a patient would get an antidepressant, and to that, either they get a placebo or they get the investigational medication. And they don't know and we don't know. That's what's called a double-blind study. And that may last for 8 to 14 weeks or something like that. And then often these studies do a follow-up study where they'll definitely stay on the antidepressant and definitely get the investigational medication, because we want to see long-term safety studies. And that study can last a year, where they're coming, getting reimbursed for time and travel, it's still anonymous, but they're definitely getting a known and approved antidepressant and definitely getting the investigational medication. And I'm adjusting dosages based on symptoms. And you just said the other day that people over the summer had said that you've been best you've been in a long time.
Yeah.
Actually, I was going to ask about, and you just mentioned it, the compensation for time and travel. Were you compensated? How did that work?
Yes. Yeah.
So, in other words, what happens is when you go into this, that's the other issue, insurance. How did that work? Or do you need insurance to do this?
No, you don't need insurance. I currently don't have insurance, so.
And you're still in the second study. Now, there's one other thing, you just mentioned this to me, we're going to bring it up, but your experience obviously with Doc Leon in this study was positive, is that correct?
Yes.
Tell me about your son.
Well, my son had been misdiagnosed with ADHD and bipolar, and had been on medication that only made things worse.
How recently was your son evaluated?
He was evaluated about a month ago.
Okay, so this is like current we're talking
Yes.
about. Okay.
So I spent a lot of time evaluating him, and I asked about worries, and he's been worried for years and years, and worried that terrible things are going to happen to him or the world, and so he's just misdiagnosed, and the worrying was really his problem.
I'm bringing it up, and the reason I'm bringing it up with Karen is because you went through the process with Doc Leon, and obviously there was something that raised your comfort level to say, you know what, this is something that I feel comfortable with bringing my son into as well. Is that the case?
Yes.
Okay. So I know it's only been a month. How's he doing?
He's doing better. He feels better that he's involved in the study, and he feels he has something to look forward to.
That's the name of the game.
Well, I just want to go over this again. So what happens, he came in, he'd been diagnosed with ADHD and bipolar and probably oppositional defiant disorder as well,
Yes.
which is a classic. But spending time with him, it turned out the true diagnosis was generalized anxiety disorder, so GAD. He'd been misdiagnosed for years, put on the wrong medication for years. People hadn't taken the time, which we did together, the three of us, understanding every symptom. And it was so clear to him that he had been misdiagnosed, and the correct diagnosis, you could see the relief on his face just getting the diagnosis, because he was starting to give up hope. I felt that way, because the medication clearly was making him worse, so he's probably thinking to himself, well, this what's the future? Because things were just going from bad to worse.
And so, as a parent, I mean, obviously, and I'm going to ask you to just to off the bat, or off the cuff rather, if somebody said, you know what, my child may be having that issue, what would you recommend?
I would recommend that they try a clinical trial. They really don't have anything to lose, and their child is very closely monitored. They're tested for any other kind of medication they may be taking, and all of that is very closely monitored.
Now, again, I appreciate you being here and sharing not only your own experience, but the experience of your sons with us as well. I mean, it can be difficult to talk about. However, I'm sensing there's a level of success that he's had and you've had also.
Definitely.
Okay. Again, to me, that's the name of the game.
This is, but part of the success here is just making the correct diagnosis. Instead of coming to a family doctor and just automatically saying, oh, your kid can't pay attention in school, he has ADHD, try this medication, or even psychiatry, have HMO insurance or Medicaid insurance, or just waiting 6 months to see a psychiatrist. We see people in a week or two. They can get into our office. There's no cost to them, and they said we reimburse them for time and travel if they get into a clinical research study. If they don't qualify for a research study, we make a suggestion for a treatment plan on what they might do. And originally with your son, I wasn't sure that he'd meet criteria for a research study. We had to spend that time seeing what his problem was, and we spent that time.
How'd your son and the doc get along?
Great.
That's all I needed to
he
hear.
likes
Why
your
Doc
sense of
Leon?
humor.
Why now? The answer is obvious. Why Doc Leon? Why now? 866-DOC-LEON, CFEF.com. Don't touch that dial.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
Welcome back to the Doc Leon Show, 866-DOC-LEON, CFEF.com. Got the new website up there. You got to look at that video. If you're interested in any of the studies we're talking about, certainly there's plenty of links on there to click on. But, we were just talking with Karen, and you had said something during the break. What happens after these studies? How does that work?
So for everybody, I offer 5 visits at no cost to them when the study's over. So for somebody like Karen, who's doing very stable, the medication that she's on, the investigation medication, is not available. But what's innovative is that investigation medication is just a takeoff of some medication that's already available. So if she's on a certain antidepressant, I'll be able to get that for her, maybe from the pharmaceutical company at no cost to her, or if it's generic, very inexpensively, and get the study medication or a variant of that for months.
Now you're talking about the innovative areas of these studies. Now, I'm assuming now when we talk about this, it's ADHD, bipolar, depression, anxiety. We're talking about this in general for all of these studies?
Correct. So for every study, when the study's over, at no cost, I see them for 5 visits. And for some people, those 5 visits can last a year because they've been in the study for a year. I'll see them every 3 months, get the medication available to them through the pharmaceutical company. When they come in, I'll hand them the medication in a big bag from the pharmaceutical company, and they'll see me in 3 months from then at no cost to them. No insurance involvement, nothing at all.
Innovative is that there's no cost. I mean, that's, alone that's innovative. And we're talking about the medication. We're also talking about you. We're talking about the experience at the Center for Emotional Fitness. It is not a normal, routine, clinical type of experience, isn't it? I mean, I'd like you to tell people what that feeling is like. When they call, everybody's all nervous about making that call to begin with. Why shouldn't they be nervous?
Well, they're going to call 866-DOC-LEON, dial extension 22. My nurse, Terry Marini, who I've worked with for 25 years, I worked with her at Memorial Hospital in Mount Holly, and she's very insightful and helps people to understand what's going on when they call us. She explains everything to them, helps determine if a clinical research study may be appropriate for them or maybe not. Sometimes, unfortunately, people have multiple medical problems that are unstable, they can't be in a study. But if people have a fairly healthy, a research study may be a great opportunity for them. Everybody has my cell phone number.
I don't know whether you can see this or not, probably not. It says Leon Rosenberg in there. Let's see if it connects actually. I want to see if I can actually get you to ring this. I'm going to put you on speaker. Go ahead, answer it.
This is Dr. Rosenberg.
Okay, all right, that's it. So that really
Finally,
is your
you called
number.
me, Eric, finally.
Again, we're talking about some things that affect millions of people. 50% of all people, 50%. ADHD, bipolar, depression, anxiety. Why Doc Leon? Why now? Should be pretty obvious. 866-DOC-LEON, CFEF.com.
856-296-8547.
And that's the cell phone. You can
me a
call
call.
Doc Leon right now. Don't touch that dial.
Depression got you down. Are you losing the battle against depression? Not sure how to fight back? If you're sad, tired, or hopeless, call us to learn about participating in a research study. Our research study is testing an investigational medication for depression taken in addition to prescribed antidepressants in adults 18 to 65. Participants receive study-related medication and evaluations and compensation for time and travel.
I'm Dr. Leon Rosenberg. Call me at 866-DOC-LEON. That's 866-DOC-LEON.
This is the Doc Leon Show. We are just about out of time, but I want to remind everybody, adults, kids, there is a clinical study here, whether it's ADHD, depression, anxiety, bipolar. There is a research study that Doc Leon is doing now that certainly can help. One of the things that we had talked about, we mentioned it before, but it's worth mentioning again, how many people are affected and how long do some people wait?
Well, in a lifetime, 50.1% of people have one mental illness or another. And we haven't discussed the bipolar disorder. That presents with either too happy, too giddy, too excited, or angry for days at a time. ADHD is inattention, impulsivity, acting without thinking, or hyperactivity. Depression is feeling sad, tearful, empty, or having lost interest or pleasure in things. So, and anxiety is worry. And for some people, worry, anxiety, nervousness, concern, stress, fear, what if this, what if that? And people have these symptoms for 10 years. It's a sin that people wait that long to go for help. We don't charge anybody to come and get diagnosed. If they don't meet criteria for a research study, I'll write out a treatment plan and send them to their family doctor. They get reimbursed for their time and travel. The medication is at no cost to them. The follow-up is at no cost to them. Call my cell phone, it doesn't charge. They can text me, whatever they want to do. I'm available to help people. People wait 10 years. The morbidity, the length of illness, and the unnecessary suffering that people have because they haven't had the right diagnosis. So we're going to educate them about the diagnosis, put them in a research study where they get further educated. They may not get better in the research study, but then we're going to follow up with 5 visits at no cost to them, use innovative medications, stuff that may be better than what's out there, and then when the study's over, provide them with medication that is available. This is something that people need to do. I'm trying to reach out to people, get them off the couch, call my cell phone right now. This is not live. You can call me right now, unless it's 2 in the morning. You can wait. But I'm available at all times. I have a not that busy a private practice because I cut back to make myself available for these research studies to let people have access to me
And the
anytime.
help is here. And that's, what we talked about, the innovative pieces of the research. We talked about the medications that you can't get anywhere else. We talked about the fact that CFEF is a unique entity. In fact, if you want to see how unique it is, go to the website. There's a little video on there we showed a little bit of earlier. Watch, that's a tiny little thing. You're going to see a practice that's been set up really to make people comfortable. And of course, the bottom line is help. So, 866-DOC-LEON, CFEF.com. You can call Doc Leon on his cell phone, you know that. Final words, okay? As somebody sitting there saying, I think I'm going to make the call. Look, you got millions of people suffering, or millions of people who are affected by these issues. You got people there that are sitting and going, why should I call? Why should I call? What would you say to them right now?
So I've been blessed with the opportunity to help you out there. Give me a call. We want to help people. I have a great staff who's interested in helping people. We have pharmaceutical companies who want their medications on the market. There's no reason to have these problems. If you have any question that maybe you do or maybe you don't have a problem, it's completely anonymous. Nobody will ever know that you came to see me for a diagnosis at no cost to you. So this is a no-brainer. Give me a call, 866-DOC-LEON, 856-296-8547. We're located in Cherry Hill, easy access, high-speed line, taxi cab, whatever you need to get to us. We're working on that. We'll work something out.
You've made it easy. Doc, appreciate it. 866-DOC-LEON, CFEF.com.
The preceding was a paid presentation for the Center for Emotional Fitness and was brought to you by Dr. Leon Rosenberg.
Businesses to watch.